Hi YouTube, welcome to my recap of general surgery rotation week number 2. I cannot believe it's already halfway done. Our rotations are 4 weeks long and like I said, it's already been 2 weeks. So I thought I would do a quick recap. My surgeon was out of town at a surgery conference Monday through Wednesday, and instead of going home, which I guess I could have done, I stayed around with the other docs here, the family doctors, and just kind of hung out with the people that were on call. And I loved that. So at this hospital, one doctor per day is what's called the on-call doc, and they don't have anything really on their schedule for the day. It's just that when people call in and say like, oh, I think I'm getting a cold, or I need to be checked over for a cough, or just like UTIs, and I don't know, just the other basic things, or someone gets cut and they said, oh, I need to come to the doctor, it goes to that physician. And so you see a lot more of the obviously acute stuff. And also, you cover the ER, so anything that comes into the ER, they're pretty much the ER doc for that day. And that is just so much fun. I love it. I don't even care if it's a cough, or it's a fussy baby trying to rule out ear infection, or if it's something in the ER. I love everything. So that was really, really fun. I did that Monday and Tuesday, and then Wednesday I pretty much studied, but they called me if they had anything really interesting. And so on that, I saw some lacerations, I got to do some joint injections, I saw quite a few things come into the ER, I helped out with a vasectomy, which was really cool, and I saw a case of shingles, the ophthalmic shingles, so it was on, this part of the cranial nerve 5, which is always kind of scary because you worry about the eye involvement, but that was just a really interesting case. And lots of concussions. I felt like I did a lot of concussion screening and that. So that was kind of my on-call days. And then my surgeon was back on Thursday, and we did some more colonoscopies and EGDs. And then the cases we had were, we had a gallbladder and a colon resection and a temporal artery biopsy. So some pretty cool cases there. And I'm not really feeling queasy at all in the ER anymore. So that makes me happy that I'm overcoming all of that. I feel a little bit more useful. I feel more like a team member instead of like the dumb med students who's standing there holding the retractor. So that's me, work the suction, and I still, hold retractors. But it's really cool. Like holding someone's like bowel and colon and small intestines like in your hands is a crazy feeling. And I don't know, surgery is just really amazing to me. And I get to man the camera when it comes to the laparoscopic, like with the gallbladder. So I'm really enjoying that. And we also had clinic, so you just see all the post-op patients, that are coming in 2 weeks after they had their gallbladder removed, and also anyone who is a surgical consult, so someone who had seen their family doc and was having maybe a possible hernia or something, then that we see them then. And and then I helped out with the flu shot clinic. So I pretty much I live at the hospital, so I just like to keep busy. So anytime I hear of anything going on, I always like to help out. So I heard the flu shot clinic was going on, and I'd given a few shots in the ER before, but I don't know, I'm still in the stage where if someone asks me to do something, I'm still like nervous. If they say, oh, how about we do the shot, I'd be like, oh, whoever the nurse is, like, can you come in and just walk me through it? And so it was really good to do that because I did like 36 of them in an hour, and I got really good, and some people were like, wow, that didn't hurt at all. So I don't know if that was me at all doing anything, but it felt pretty great. Some extra things, let's see, one of the docs invited me over to their house for dinner, so I got to see his family, and I actually got to see a little girl that I had delivered last year, so it was really fun to obviously have seen her grow up and be like, wow, that's just so crazy. So that was really cool. And let's see, went out with some of the docs, celebrated one of their birthdays, and so that was fun to be kind of part of the group and feel included like that. And they joked that they were trying to get me out of the basement because that's where I live, so I was very thankful for that. And the docs are pretty nice with whoever's on call. If they go out to lunch or something, they usually invite me along, even if it's just to get out for 20 minutes, but it's really nice. And I also was interviewed for the local newspaper, and so I think it was something on the medical students, and they took my picture and stuff, so that was interesting. Let's see, what else? And I've just been studying. I tried to study. I'm not feeling very motivated. It's weird being now a third-year student, and you don't necessarily have like tests every week and PowerPoints to look at, and I don't make my study guides or anything. I just kind of have these vague objectives, and I know I have a test, which I signed up for. I'm taking it on Friday, and I have to drive back for that. So it's a little bit more real, and I do not feel prepared at all. I don't know what to study. I have these books, and I read them, but I don't feel like I'm retaining much, and anyways, I need to work on that this next 2 weeks. Next weekend will definitely be a study weekend where actually I think I'll have to make my own study guides, because I have to manipulate the information in order for me to learn it. So we'll see. And I guess I just have to pass these tests, but I would like to do well and learn the information for my future patient's sake. Also, on talking about exams, we have now already registered for our level 2 PE exam. We have to fly out to Pennsylvania for that. So, and it's so expensive. It's like, I don't know, $1,600 or something, and then both John and I have to do that, so, that's frustrating. So that's August 5th. It's scary already having a date on the calendar for the exam, even though it's like a year away. It's still like 10 months. It's, I don't know, a little intimidating. So I also bought ComBank, question bank, I was starting to worry about my surgery test, and so I've been doing some of the surgery questions, and I've been getting anywhere from the 50% to the 90%, so I'm all over the board on that, and I just take like 10 questions at a time, and hopefully that'll help me prepare for my level 2 boards as well. I'm planning to take the written or the computer part, I think July maybe. I have to talk to John and figure out when we want to do that one, but that's also more money, which, I hate. I think that's all. Those are the big things. I don't know, what am I saying now? I read about the colon, the rectum, the anus, the pancreas, the liver, breast. Those are some of the topics I read about this week. And again, I read on them, and I feel like I don't know anything. Like today, we have our like chats, which is kind of like where he quizzes me. And I don't know, I feel like I can't answer very well. He's like, if you have nipple discharge, are you worried about it? Only if it's bloody. Okay, well then what do you do then? And what are you worried about? It's like, I know these things, but it's like I can't say them. So, I don't know. I need to work on that. And that's about all. To finish up, I have kind of a funny story to tell you. This is an embarrassing story about me, but I thought you guys might enjoy it because all the nurses and the docs, and it spread, so the whole hospital knows this story. Anyway, so my general surgeon loves classic rock, and so that's what's playing on in the surgery room, and he always asks okay, for the day, tell me the artist of this, or the band, or the song title. I have no idea. I mean, I recognize a lot of these things, but I don't know if it's my generation or if it's just me, but I do not know who sings all the songs. It's probably me. I just don't. I don't know. It doesn't matter to me who sings it. So I don't know anything. And so the nurse anesthetist was helping me out. I think this was Thursday, just yesterday, and a song came on, and I had no idea, and so the nurse anesthetist had written it on a little clipboard on a piece of paper and held it up for me. So here we are in surgery, and he holds up this clipboard. It's Van Halen and, I don't know, someone who was singing the song. And so I played it off what is it? I think it's, is it Van Halen, and is it blah, 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 who sings it? See, I can't even remember who it was. He's like, wow, I'm impressed. This is awesome. And I was like, oh my gosh, I just felt a little guilty because I kind of lied. Or cheated. And so the next one comes on, and the nurse anesthetist also, writes down the band, I guess, the band name, and it's okay. is it 22 top? And it's silent. So I'm thinking, woo, I got another one right, sweet. And all of a sudden they start laughing, and he just shakes his head, and he's like, what? And I guess it was ZZ Top is a band, which I feel bad, but I don't know who that is. I've never even heard of them. And yeah, they got a kick out of that. I'm pretty soon, like, everyone who worked in the hospital knew that story. So, anyways, so he joked. He's like, I think you just failed your rotation. And he's like, now any future medical student who's nervous about getting anything wrong or saying like the wrong band, he's like, nothing can top that. I always tell the story about you and how you made that up. But it did. Like the two Z's look like twos, and why not 22 top versus ZZ top? I don't I didn't know. Anyway, so that's all. And now it's Friday, and I'm done for the day. I need to do my little patient logs, make sure I, put all the patients I saw in today. So I keep track of that. And John's coming. He's meeting me here tonight, and then we're going to drive up to go to like our hometown. We have a wedding this weekend for one of our high school friends. And so, yeah, that's what we have planned for this weekend. I'm super excited to see him. I haven't seen him for 2 weeks, so this will be great. And next week seems like a regular surgery week. He's here all 5 days, and yeah, that's all. Let me know if you guys have any questions.